Great. Good morning, everyone, and welcome. And I also want to welcome those who are, including from the media, who are viewing through the live stream today. I'm Scott Wiener, have the honor of representing San Francisco and northern San Mateo County in the California State Senate. We are here today to announce two major pieces of healthcare legislation to reduce the cost of prescription drugs for Californians. And I'm joined here by an amazing coalition, including the American Diabetes Association, the Chronic Care Coalition, the California Pharmacists Association, and SEIU, United Healthcare Workers, who have come together for this important legislation. We also have a growing coalition, and I want to just acknowledge a Consumer Watchdog, which is one of our major consumer protection organizations in California, couldn't be here today, but is supporting both of these bills. We know that as amazing as California is, it is incredibly expensive to live here, and the cost of living just keeps going higher and higher, and it is pushing people out of our state, and we need to take firm action to get costs under control. And people have a right to be upset with how expensive things are. We know that there are various aspects of this, including the cost of housing, of childcare, of energy, transportation. But one of the big components is the cost of prescription drugs. And we know that there are people who are really struggling to afford their insulin or other drugs, people who are foregoing doses or rationing their drugs, including their insulin, and that makes people less healthy. It creates enormous stress for people, and it's just unacceptable. We also know that California has fallen behind other states in terms of taking basic steps, which we are doing with our legislation that we're announcing today, to reduce prescription drug costs. 25 other states, including red states like Texas and West Virginia, cap the price of insulin copays for private insurance. California does not. 25 other states regulate the pharmaceutical middlemen known as pharmacy benefit managers, which drive up the cost of drugs. California does not. It is past time for California to take action on this issue. So our legislative package that we are announcing today, the Prescription Drug Affordability Package, or PDA, consists of two bills. First, SB 40 caps monthly insulin copays at $35 a month for most private health plans. So you will not have to pay more than $35 a month out of pocket each month with your insurance. Currently, federal law for Medicare recipients caps copays at $35 a month, but private insurance is not limited. And so SB 40 will cap those monthly copays at $35 a month. SB 41 has to do with what I mentioned before, PBMs, pharmacy benefit managers, which are the middlemen of the healthcare industry. They basically control the drug supply chain, and they are sit right in the middle of pharmaceutical companies, health plans, and others, and they drive up the cost of prescription drugs with the way that they're compensated. They have an incentive to favor high-cost drugs over low-cost drugs. They create the formularies for health plans, and they are driving up the cost of prescription drugs, and they're pushing local community pharmacies out of business because they effectively force people to use their own mail-order pharmacies instead of people being able to go to their community pharmacy. SB 40 and 41 combined will help to reduce the costs. And this is not rocket science. PBMs in particular, there have been numerous studies and exposés over the last year showing the impact that PBMs are having on the cost of prescription drugs. The New York Times, Wall Street Journal, and others have run scathing exposés on this industry and their practices that are raising drug costs and harming patients. And so I'm really excited about this these two pieces of legislation. I'm excited to move them forward. With that, as I noted, we have a great coalition here today, and I want to start by welcoming up Liz Helms, the President and CEO of the Chronic Care Coalition, one of our amazing healthcare advocacy organizations in California. Oh, sorry, to fall down.
Thank you.
Thank you.
Thank you, Senator Wiener. I'm Liz Helms, L-I-Z-H-E-L-M-S, President and CEO of the California Chronic Care Coalition. We are so proud to be here today with Senator Wiener on supporting these two bills and even sponsoring them. The California Chronic Care Coalition stands for affordable access to quality health care. People can't afford their meds, they can't take them, it hurts them. Medications are a key part of having a better quality of life for people with chronic conditions. I have multiple chronic conditions, including diabetes, and I can't imagine if I could not access my medicine. So we stand here to get all together today in this amazing coalition. We're so excited for SB 40 and 41 to be unrolled today, and we look forward to really making this happen this year and making it better for patients, for all patients in California. Thank you so much.
I now want to call up Dr. Shagun Binlish, who is on behalf of the American Diabetes Association and who is a specialist in diabetes care.
Thank you so much, Senator Wiener. Good morning, everyone. So I'm Dr. Shagun Binlish, S-H-A-G-U-N-B-I-N-D-L-I-S-H. I have a specialization in diabetes and have done my fellowship training program about a decade ago. I'm currently scientific chair of American Diabetes Association and founder of Golden State Obesity Society. So I have dedicated all my career in supporting patients with diabetes and obesity. And believe me, this is very close to my heart. So California is facing critical healthcare affordability crisis, and particularly for over 4 million individuals who are living with diabetes in our state. So insulin is a life-saving medication. Nobody gets the diabetes or any chronic condition by choice. And insulin is like a lifeline. So that's why it is not only important for type 1 diabetes patients, but it is also important for many of the patients who are living with type 2 diabetes, which is actually another very common condition. The stark reality is that insulin prices has tripled over the past decade. 1 in 4 insulin users reports underusing this medication due to the cost. And patients are actually forced to into impossible choices, like they have to cut down on their insulin usage, or they have to potentially avoid life-threatening credit card debts. They are just trying to ration the insulin. In my practice, I have witnessed so many patients actually rationing insulin, cutting doses, or completely skipping the treatments. And I recall a patient, a young patient who was who was actually a college-going student who was working at least 3 shifts just to cover the cost of her insulin. I also know another single mom who has type 1 diabetes, but she's not able to afford insulin because just to meet the childcare needs. So this is like very, it's like a drop in the ocean. The examples I'm telling you, I have seen this very closely in past few years. We have a moral and medical imperative to act. So by joining 25 other states and Washington, D.C., California can implement critical patient populations. And this bill is going to, which is going to help to cap insulin copay at $35 per month, is going to be huge cost saving and blessing for the patients who are living with diabetes. So it will also provide immediate financial relief. It will prevent dangerous medication rationing, and it will protect families from devastating medical costs. So this is more than a policy, and it is we all have to understand and agree that it is a lifeline for millions of Californians, and changes like this just does not improve lives, but they also save them. And together, we all can make a difference. So please support this bill, and I really, I'm very, very thankful for this opportunity and you supporting this bill. Thank you.
Thank you, Doctor. We are also really proud to have support from SEIU, United Healthcare Workers, and here on behalf of SEIU UHW is Joseph Brown, who's an interventional radiology technician.
Thank you, Senator. Joseph Brown, JOSEPHBROWN. I'm an interventional radiology tech and member for SEIU UHW. Good morning. Like all Californians, SEIU members feel the pinch of skyrocketing prescription drug costs in our pocketbooks, and we feel the human toll in our communities when members of our families can't afford the life-saving drugs like insulin. As healthcare providers, we see firsthand the devastating impact of unaffordable insulin on our patients. I've seen patients who have had to choose between refilling insulin or paying their rent. Skipping doses of insulin can mean more than feeling unwell for a day or two. It can also lead to life-threatening conditions like infections, wounds, limb loss, and ultimately a loss of independence and dignity. This leads to higher healthcare costs down the road. And now working people are going without this life-saving drug simply because corporations have been allowed to exploit people who need insulin to stay alive. Insulin costs 10 times more in the United States than in other countries. So we know exorbitant costs we face in California and around the nation are not due to manufacturing costs. It doesn't have to be this way. The Biden administration capped insulin costs at $35 a month for seniors and Medicare. They showed that we can take on these greedy corporations who are putting record-setting profits over the value of human life. We know that diabetes disproportionately affects low-income communities, seniors, and people of color. In other words, the high price of drugs is both an affordability concern and a critical equity issue in California that we must address. SEIU members are proud to stand in strong support of Senator Wiener's bill to ensure equitable access to insulin because we know healthcare equity is fundamental, not optional. Senator Wiener's legislation capping insulin costs helps those who can least afford exorbitant out-of-pocket costs and will ensure no one has to skip or ration this life-saving medication. We stand in support of Senate Bill SB 40.
Thank you, Joseph. So next, we are really proud to have as co-sponsors of these bills the California Pharmacists Association, who are our community pharmacists are so deeply impacted by pharmacy benefit managers in particular. For anyone who's had a situation where you are given the option of either getting a 90-day supply of medication if you get it by mail, or 30 days only if you go into your pharmacy, that's because of pharmacy benefit managers. That's their way of trying to force you or manipulate you into using their mail order pharmacy instead of your local community pharmacy because, of course, it's much more convenient to get a 90-day supply instead of having to go in every 30 days. So on behalf of the California Pharmacists Association, I want to welcome up Dr. Maria Lopez, who is the owner of Mission Wellness, one of our great community pharmacies in San Francisco.
Thank you, Senator Wiener. So my name is Maria Lopez, M-A-R-I-A-L-O-P-E-Z. I'm the Director of Pharmacy at Mission Wellness Pharmacy here in San Francisco. Mission Wellness Pharmacy has been in on the same block since 1978, serving the community primarily in the southern part of the city, but everybody in San Francisco and even outside of San Francisco. Mission Wellness was very instrumental during the COVID pandemic, providing over 100,000 vaccines and COVID-related services. What I wanted to talk about was our experience with pharmacy benefit managers. They are behemoths. We have been involved in multiple litigations with these behemoths who are ultimately raising the price of medications. And we did win an arbitration several years ago, but we have been on a multi-year-long, publicly unsealed arbitration with CVS Health. And these are normally private, not known to the public, because our contracts don't allow us to talk about these things. However, a federal judge unsealed the record. And so we won. However, Caremark, CVS Health, which is a Fortune 500 company, has not wanted to follow the rulings. And so we have been in appeals by these big this big company and behemoths, and it's really a David and Goliath fight. But we are doing this because as pharmacists, our oath is to take care of patients. And it felt it was very important to stand up to the bully and fight back. Thank you.
Thank you, Dr. Lopez. And then finally, our final speaker is Rhea Bindlish, who is a youth ambassador for the American Diabetes Association.
Hello, everyone. My name is Rhea Bindlish, RIYA-BINDLISH, and I am the Youth Ambassador for the American Diabetes Association and also the president of Dublin High's American Diabetes Association chapter. I am here today to provide a student perspective to this issue, and some of the most important topics I want to include today are health equity, mental health, education, and lifestyle. So for health equity, California is one of the states with over 6% of the people that are uninsured, and providing accessible access to all of the students is extremely important despite their economic status, especially because schools are so diverse. Secondly, mental health and education. The use of insulin on a daily basis can already have a mental impact on students, and these students should be focusing on their academic career during this time, and simultaneously managing mental health and insulin can lead to additional stress. And lastly, lifestyle. As a member of the swim team myself, I understand the importance of maintaining an active lifestyle, as students are so viable to perform in athletics in their schools. It's very important to ensure that diabetes management is never compromised when it comes to student activities. Thank you so much.
Thank you. Thank you. So those are our speakers. I also want to, I neglected at the beginning to thank Curry Senior Center for hosting us today in this amazing, beautiful building in the heart of the Tenderloin. So thank you. So those are our speakers. We're happy to take questions from the press, either here or who are watching via live stream. And I think we had some questions already.
Yeah. From Politico, both of these bills have been vetoed by governors in the past. How do you plan to get past executive opposition this year?
Well, our goal this year is not to have executive opposition. So it's very common that sometimes a governor vetoes a bill and the bill gets reintroduced, and you just keep working on it. We worked with Governor Newsom on various important health policies. For example, he has signed several major pieces of mental health legislation that I've authored to require health insurance companies to cover more mental health. We've worked with the governor on various other issues, and our job is to make the case to him that he should sign these two important bills. So, you know, I respectfully disagree with the governor's veto of the two bills, but we're going to keep making the case. And there have been other examples of situations where a governor has vetoed a bill, and then a year or 2 years later, the bill gets reintroduced, and then the governor ends up signing the bill. So that's what we're going to do. These are very, very good, important policies. And I want to also just note that these two bills passed the last time we introduced them, last year and this year, with overwhelming bipartisan support. The insulin copay cap bill, the previous version of it, got essentially unanimous support in both houses. The PBM bill got very strong bipartisan support. There is bipartisan support in Congress to crack down on abuses by pharmacy benefit managers. This is not these are not controversial ideas, and so we'll make that case to the governor. Yeah.
The governor's CalRx program promised to deliver affordable insulin to California. Do you have any updates on what's happening?
Is that from Politico as well?
That's from Bloomberg.
From Bloomberg. I can't speak on behalf of the governor. Created CalRx, and it's a program that he is pursuing, which I support, so that the state of California would manufacture its own insulin and also naloxone. And I think if this succeeds, and I hope that it will, it could really help reduce costs. So I support CalRx. I do not know the status of it. That is a question you'd have to ask to the governor. Nothing else? Okay, any other press questions? Nope. Okay, thank you so much, everyone. I very much appreciate everyone being here today. And thank you, Curry Senior Center.